Okay, we're working for your health with the Day of Answers about the flu. We are right here in flu season. I'm joined by Scott Berger from Choice One Urgent Care. Dr. Berger, so many people get their flu shots, but unfortunately, there's a lot of people who don't. What's the number of people who don't get it, and what are some of the reasons that you hear for people not getting their flu shot?
Yeah, they estimate about 50% of the U.S. population gets it during any given year. There's lots of reasons people decide not to get it. Most of it is based on, misperceptions about the ability for the flu, for somebody to get the flu from the flu shot. You can't get the flu from the flu shot.
Some people are concerned about that, or they might feel bad for a few days after they do get it.
Right. So as your body responds to the vaccine, it can trigger a little bit of a response to make you feel unwell for a day or so, but that's a small price to pay for some of the patients relative to getting the actual influenza virus.
That's not the flu.
No. The influenza virus is much more significant. It lasts 5 to 7 days, high fever, cough, sore throat. If you've ever had it, what I tell people is when you've had the flu, you know you've had the flu because it's so different from the common cold. It's so much more severe.
So if there's people out there on the fence and they're saying, look, maybe I should get it this year, but I haven't gotten it in some previous years, how do you convince those people to come on in and get that flu shot?
It's really tough. We've got to spend a lot of time educating people and it really counsel them, make sure that they understand that the flu shot is not dangerous, that they're not going to get the flu from it. Also to dispel some of the concerns that people have around preservatives and the associated risk with autism that some people were really concerned about. That is not the case at all. They've also changed the way that most flu shots are manufactured, and you don't have eggs in them anymore. So we can get more people to have the flu shot now. And we really just need people to really believe that this is a serious healthcare problem. Last year, 80,000 people in the United States died as a result of complications from the flu. Normally, it's about 40,000 people a year. That's a huge number of people that we can prevent really, death and severe disability from a simple shot.
And if they'd gotten the shot, it's likely they would not have contracted the flu last year.
Right. They might not have contracted, or if they contracted, they probably get a less severe strain or not feel quite as unwell because their bodies had a chance to make antibodies from the vaccine that they were given.
Dr. Scott Berger, Choice One Urgent Care, thanks very much for coming in today. We're having a Day of Answers about the flu. We'll have a Facebook Live a little bit later this morning as we continue talking with Dr. Berger. And Choice One Urgent Care is helping us out, offering a special deal on how to get a cheaper flu shot. You can find more information about that right now on our website, WMAR2news.com.